Nowadays, millions of Malaysians are affected by disease they never expected, not from infection, but from lifestyle. Diabetes, obesity, heart disease. This is the silent crisis of non-communicable disease. So, the question is Malaysia ready to face this growing health crisis?
Now, Malaysia is facing a critical public health crisis, with non-communicable diseases accounting for about 140,000 deaths this year, far surpassing the 36,000 fatalities recorded during the COVID-19 pandemic over 2 years.
Assalamualaikum and greetings everyone. We are from Group 2.
Today, we will evaluate the National Strategic Plan for Non-Communicable Disease,
also known as NSP-NCD in Malaysia.
This policy focuses on addressing non-communicable disease.
We will discuss the problem, objective, strategy, evolution, and recommendation.
Before the implementation of NSP-NCD, Malaysia was already facing serious health challenges. The number of people with diabetes increased significantly from 8.3% in 1996 to 11.6% in 2006. In addition, obesity and hypertension rates were also high. Many individuals were unaware that they had this disease, making the situation even worse. As a result, the healthcare system experienced increasing pressure, including high treatment costs and greater demand for hospital services.
The shortage is especially acute for specialist doctors in public hospitals. According to the Malaysian Medical Association, Malaysia's population to specialist ratio is approximately 4 doctors for every 10,000 people. It's significantly lower than the OECD's recommended ratio of 14.3 specialists to 10,000 people.
Furthermore, previous programs were not well coordinated. Most initiatives were focused only within the health sector and lacked collaboration with other ministries and stakeholders. Therefore, a comprehensive and integrated policy such as NSP-NCD was necessary to address this growing issue.
The main objective of NSP-NCD is to prevent and control chronic disease, particularly cardiovascular disease and diabetes. The policy also aims to improve the overall quality of life and promote longer and healthy living. In addition, it focuses on reducing major risk factors such as smoking, unhealthy diet, physical inactivity, and harmful use of alcohol. The policy also aims to strengthen national healthcare management and increase public awareness through health education and promotion programs. Overall, those objectives are designed to create a healthier society and reduce the long-term impact of non-communicable disease in Malaysia.
To achieve this objective, several key strategies were introduced under NSP-NCD. The first strategy is prevention and promotion. This focuses on encouraging healthy lifestyle through campaigns related to diet, physical activities, and smoking reduction. The second strategy is clinical management. This includes early detection, screening, and proper treatment to reduce complications among patients. The third strategy is patient compliance, which encourages individuals to follow treatment plans and medication properly. Another important strategy is collaboration. This involves cooperation between government agencies, non-governmental organizations, and local communities. Programs such as COSPIN and Enhanced Primary Healthcare are examples of these initiatives.
Because we all agree we can stay on that path. We must take the same road together to beat avoidable NCDs. Next year, we will meet at the UN General Assembly high-level meeting on NCDs. This meeting will generate momentum towards achieving the Sustainable Development Goal target of reducing premature deaths from NCDs by 1/3 by 2030.
These strategies aim to provide a comprehensive approach to addressing NCD issues in Malaysia.
One of the key strengths of NSP NCD is the implementation of the whole government approach. This means that the multiple ministry and agency are involved in addressing non-communicable disease.
It places greater emphasis on the role of NGOs, the private sector, philanthropies, and academia. And it shows that action on NCDs is essential for sustainable development in all countries. And their capacity to make bold political choices for health in the face of commercial interests. To accelerate action to save lives and strengthen our societies, and beat NCDs once and for all.
As a result, there has been an increase in public awareness and participation in health-related programs. Various initiatives such as community exercise program and school-based health campaign have been introduced. In addition, there has been a slight reduction in smoking rates, indicating a positive impact of the policy. However, despite these strengths, there are several weaknesses still exist. Firstly, enforcement of the health policy still remain weak. Some individuals continue to ignore the health regulation and guidelines. Secondly, obesity rate continue to increase, showing that the behavioral change is still not effective enough. For example, more than 21% of the adults are classified as obese. Thirdly, the monitoring system is not conducted frequently enough, making it difficult to track the current trends. In addition, a coordination between the agency can still be improved as some programs overlap or lack of consistency. Therefore, although the policy has shown progress, there are still significant areas that are required to improve.
To improve the effectiveness of NSP-NCD, several recommendations can be proposed. First, coordination between the ministry must be strengthened to ensure a better implementation of programs. Second, enforcement of health policy must be improved to ensure compliance among the public.
What we're going to launch in July in Malaysia is a national health screening initiative. We're targeting 1.5 million people above the age of 40 who've never had health screening before to be given free health screening at our public and private clinics.
Third, greater emphasis should be on a behavioral change through awareness campaign, education, and lifestyle intervention. Finally, a real-time monitoring system should be developed to provide an accurate and updated data. Without strong implementation, even the best policy cannot achieve its intended goals.
No está